today on the Frontline Health podcast.
You can start with those over-the-top claims. So if they talk about it's going to be a cure for cancer, which obviously is way out there when we're talking about things, but that's when you go, huh, that seems too good to be true. And typically it is because there's nothing that actually cures cancer. And I think if you look at it and they're not talking about any discussion of it may work for you or these are the things that we've seen and we've also seen where it hasn't worked for other people. I think just being honest about the efficacy of a product is where we need to start when it comes to that.
Hello, and welcome back to another episode of the Frontline Health podcast, where we share news, tips, and insights to help you take ownership of your health. My name is Evan. I'm with Troy Duell, founder and CEO of Centurion Health, and we are talking about a topic today: how to tell if a new supplement is all hype or the real deal. We are bombarded every single day by messaging. Every week there is a breakthrough supplement. There's some kind of game changer, miracle, doctor recommended, whatever descriptors you want to put in front of it. And somehow we know that they can't all be this big of a deal. So we're hit with thousands of ads per day. We have influencers, podcasts, reels, sponsored posts, all kind of things put in front of our faces. We have new products that launch constantly, often with very bold promises. And Troy, people are wanting to know, how can they tell if a supplement is hype or the real deal?
Yeah, I mean, I think you've got to be very, very careful because on both sides, because some of these supplements may actually help and bring benefit, but then others, if they're touting it as the next coming of uh, cancer curing product, then it's really, really difficult. So if it sounds way too good to be true or ultimately revolutionary within healthcare, then it's very difficult when you have claims like that to come back and go, is this true or not? So hopefully what we're going to do today is work together to provide a good framework that we can really walk through some of that noise and hype that's out there so people can decide for themselves whether a supplement is exactly what it's supposed to be or if it's just all hype and make sure that you're spending your money on the right things.
Yeah, and health and wellness really seems like an industry where hype works really, really well and is a common tactic that is used by people wanting to just make a quick buck. Um, People get really excited about something new, especially if we can make it easy because health is something that so many people struggle with. Why do you think that hype works so well in the health and wellness space?
I mean, let's be honest. We live in the microwave age, so all of us want something quick. We don't want to have to go through those hard steps to actually get there. And unfortunately, for a lot of our health, there's not a quick fix, but it's going to take a disciplined response to what's going on. And we always look not just for that quick fix, but really for kind of that social proof. So if other people are doing it and we see them doing it and we hear their results, then we go, hey, maybe it'll work for me and it'll be that quick fix that I'm looking for. So we've got to be cognizant of what's going on and understanding that marketing agencies know exactly what those things are that will actually get our attention and cause us to jump in because none of us want to be unhealthy, and we're always looking for ways to get into better shape or better health, and we'd love to do it the fastest way possible. And I think that's why there's a lot of hype on different things out there, and we've all probably succumbed to that marketing before. And we probably will continue to succumb to it, but we just need to really take a step back and go, why do I want this? Are there things I can do alongside it to help build my health? Or is it me just looking for this quick fix on whatever it is that I'm dealing with?
Yeah, absolutely. So when we start talking about red flags that people should look out for, what are those things that you would look at and you would go, this is clearly just a fad. I don't really think that there's much benefit in it for people. What these people are claiming is not true.
Yeah, I mean, I think you can start with those over-the-top claims. So if they talk about it's going to be a cure for cancer, which obviously is way out there when we're talking about things, but that's when you go, huh, that seems too good to be true. And typically it is because there's nothing that actually cures cancer. And I think if you look at it and they're not talking about any discussion of it may work for you, or these are the things that we've seen, and we've also seen where it hasn't worked for other people. I think just being honest about the efficacy of a product is where we need to start when it comes to that. And then if there's something along the lines of just really vague information and they've just got ingredients on there, but they don't talk about what those ingredients do, I think that's a cue that, hey, maybe there's not much evidence or science behind it, and really looking for ways that you can get some cited data and studies that you can start to dive into and see that science for yourself and make that decision for yourself, whether you want to take that or not. Because testimonials are great, and I think they speak a lot and they speak volumes about a product, but a little bit of science behind it with some studies certainly is a key that you want to take into place or take into account. And then finally, if there's just all about fear and they're talking about fear, so what doctors don't want you to know, buy before it's banned, any of that kind of stuff, it's really just marketing that they're trying to create some kind of panic and there's not much clarity to what's going on. And that's when you know that, huh, maybe this isn't the best thing for me, or it's time for you to go and dive into a little bit deeper research on it yourself.
Yeah, no, that's all really good, Troy. Thank you for sharing with us things that we can look out for. And I do think that if there was a cure for cancer out there, we would want to keep close tabs on the inventor of whoever that was to make sure that they're still with us for a little bit longer.
That's right. That's right.
Yeah, make sure that there weren't any red flags about their mental health or anything like that hanging out there. On the other side of things, we do want to know, right? There's a lot of great research going on today. The health and wellness industry has exploded. It's something that people are conscious and aware of, and people, I think, have just because of where we're at as a culture right now, like they have a desire to improve their health, and so when there are new things that come out, we do want to be able to evaluate, hey, is this actually something that can benefit me or can benefit others or support my health goals? So, how can we recognize when a new supplement is actually the real deal?
Yeah, I think you have to first define the problem. So, is that problem clearly defined? Is this what's going to happen to me if I start taking this supplement? I think that's the biggest key to it. And, are they trying to oversimplify something if it is a super complex issue? That's something that you have to look at and go, is this kind of underplaying what's going on and not giving us much meat on the bone? As probably the best way to look at it. And then make sure that each of the ingredients, you recognize them or see that there is some data behind it and it can be explained on how it actually works in the body. What are the studies suggesting when it comes to this particular ingredient that you're looking at? And just taking a look at that as a whole, I think will help put you on the right path. And then if you step back and you look at the company as a whole itself that is providing this product and understand, are they in it for your long-term health? Are they saying this is the cure-all? Or are they trying to add in other things like diet and exercise and maintaining a good overall healthy lifestyle as part of adding this supplement to the regimen? I think those things certainly make a big case for this could be a product for me if they're adding those pieces in there and they're giving you the education and the information that you need to make a better choice for yourself.
Yeah, that's really helpful. And you've been in this industry for years, and I'm really curious when we start talking about things that were just hype and turned out to be a bust, and there's really no evidence behind it, or it's whatever the case may be. You've seen some of those be exposed. but then you've also seen things that come out and be truly revolutionary. So, is there anything that sticks out in your mind that you can think of on both sides of that? Either something that, was a total bust or something that, actually turned out to be something with a lot of benefit.
Yeah, I think the probably the most recent one would be CBD. That's something that came out probably 8 years ago, and people were saying this is going to cure cancer, it's going to cure this, it's going to cure that, and they just basically put this product in the midst of everything that was going on. And I think there is lots of value to some of the CBD from some of the studies that are out there. There are certainly some good sides to it, but I don't think it ever met the hype that it really warranted when it first started. And I think that's probably the biggest one that I can think of in fairly recent years, recent times, that came out with all this hype and everybody wanted to get on board with it because it was going to cure everything. And then all of a sudden, as people started taking it, some of that hype faded away, and yet it still provides some benefits to some people, but not in all the areas that it initially came out with.
Yeah. And then what about on the other side of that? Is there anything that sticks out to you as something that, was that started out as a trend and then, yeah, like it truly was really beneficial to people?
Yeah, I mean, I think the CBD on the flip side is kind of similar. It definitely brought some benefit when it had lots of hype to it, but it didn't bring it to the level that all the hype came in. And I think that happens with everything. I mean, we're seeing that with even GLP-1 medications now. There's all this hype on losing weight, but nobody's talking about the other side effects and the downsides to it. And I
Mm.
think once you get past that hype of an initial product, people start to see the reality of some of the side effects and effects it has on their overall health. And they understand that, yeah, this was good and it brings some value and benefit, but without really taking full ownership of your health, it's not going to change your life to the tune that we're all hoping one pill or one shot or whatever it may be will do. And it just comes down, unfortunately, to discipline and taking a lot of time to put together a plan to get you to the best health possible.
No, that's really good. And I mean, it's interesting that you said it's a two-sided coin because we just live in a world that does not reward or appreciate nuance. And nuance the nuance is everywhere, right? There are a lot of things that if we could take a step back and look at in that thoughtful of a way, you know, we can understand when something is going to be good for somebody or when it's not, and it's not just like all or nothing.
Right.
Like our algorithms reward us for doing, right? Making these extremely bold claims, hyping people up for something. It doesn't reward as much if you just want to sit there and explain and have a conversation and dialogue around these kind of things.
Very true. Very true.
But great things for people to kind of think about on an individual basis. We always try to encourage you to take ownership of your health. No one is going to care more about your health than you do, or at least no one should care more about your health than you do. If they are, then there's probably some self-evaluation that needs to be going on. So yeah, so we want to encourage you not to necessarily completely write off new products as they come on the market or new supplements, even when they're coated in hype, but approach them with clarity and understanding and seek to really educate yourself and learn to appreciate that nuance. Anything else that you want to kind of add on to that, Troy, as we get ready to wrap up this episode?
No, I think that you hit the nail on the head. There are always going to be good sides and there are always going to be overhyped sides. And I think whenever a new product comes out, there is probably an element of truth, which is what develops the hype, but it's just overblown. So we should never look at one product as being the answer to all of our questions or to whatever ailment we may have, but it could be a part of a total solution. And if we can look at it that way, we can go in level-headed when some of these products come out and not necessarily just jump on that bandwagon, and really feel good about the choices we're making for our health.
It's great advice. thank you for listening to this episode of the Frontline Health Podcast by Centurion Health. Go out and take ownership of your health today because you are your best health advocate. See you next time. If you enjoyed what you heard today on the podcast, please consider subscribing and leaving us a review. We would love to hear your comments or questions about anything we've talked about on the show. For more health news, tips, and insights, follow us at Centurion Health on Instagram, Facebook, X, and YouTube. And for safe, effective, and affordable healthcare products made in the USA to help you elevate your health and life, visit centurion.health. We look forward to you joining us next time on the Frontline Health Podcast by Centurion.